We conducted a trial comparing 25 fractions delivered to 50 Gray RBE versus 15 fractions delivered to 40 Gray RBE for patients with indications for post-mastectomy radiotherapy. The rationale for our study is that the prior reports that have looked at proton therapy for breast cancer have used small doses per day delivered over 5 to 6 weeks. But there's some evidence from the photon literature that side effects might be similar or even reduced if we condense the dose into larger fractions and condense the number of treatments, such as to 3 weeks, which is what we used in our study. And so we randomized a total of 88 patients, and there were 82 patients that were evaluable for our primary endpoint of complication rate, which was defined in our study as grade 3 or greater adverse events, late adverse events, or reconstruction complications for patients that had immediate reconstruction, which was about 70% of our patient population had immediate reconstruction, primarily with implants. And we were able to show in our study comparable rates of complications between the two arms. There was 6 complications in the group randomized to 25 fractions and 8 complications in the group randomized to 15 fractions, which was not statistically significantly different. However, the upper bound of the absolute difference in the rate of complications was greater than our pre-specified non-inferiority criteria, and therefore we could not claim that the new 3-week course was non-inferior to 5 weeks. Nevertheless, we concluded from this study that this shorter courses of radiation for proton therapy, and in particular this one that we use, this 3-week regimen, appear promising and worthy of a further investigation. And this is especially important because proton therapy is not necessarily available at many institutions, and so a shorter course of treatment might improve access, and it might also reduce cost of therapy as well, because of the cost of treatment is generally driven by the number of fractions which are delivered. So we think that there's more work that's needed to be done to optimize the dose and fractionation used for both photons and for proton therapy, and so we look forward to those future studies.